Hi, this is Dr. Neher Sinam, and in this video, let's take a look at the swelling right after Asian blepharoplasty. So, after we perform this procedure called the double eyelid surgery, which is done under local anesthesia, the person gets up from the operating table, and right after that, I ask them to stand near the wall where we do the photography, and they are able to open their eyes very comfortably. They are very comfortable talking and walking down the stairs and going back home. But yes, the eyes are definitely swollen quite significantly. Sometimes people look into the mirror and get worried as to why it's looking so big, and they ask me if the swelling will come down or if it's going to stay like that forever. And that's because some people come for the surgery quite uninformed of what the recovery process is going to be. So that's what I'm going to explain in this video. So right after surgery, there is swelling, and that's partly because of the injection that we give, that is the local anesthesia. We give it that injection before the surgery. Before any cut is made, the eyes are already swollen. We give about 1 ml each side, and sometimes it can go higher to even 3 or 4 ml in each side. We always try to give the same amount so that the amount of swelling stays almost the same. But then during the surgery, bleeding occurs and blood can get collected into the tissues. So, depending on whether it's getting collected on the inner corner, outer corner, upper, lower, superficial, deeper tissues, the swelling on the two sides can vary significantly. It's always my aim to keep the swelling minimum, to keep the bruising down by doing a very meticulous surgery. But it's very rare for me to get a very symmetrical result right after surgery. I would say that's less than 10%. Most people swell like this. Some swell less, some don't bruise at all, even though swelling is there. And a lot of people swell more than this and have significant bruising. And a good amount of people, they have different amount of swelling, and therefore the two sides look very different after the surgery, especially on the third or fourth day. That's like the worst day because swelling increases for 2 to 3 days, and it looks the worst on the third or fourth day. And it's, I would say, on the fifth day that it starts to decrease, and then you start seeing, that it gets better. So second or third day is usually the day when people feel very afraid. They often contact us asking if this is normal. So, because of the difference in swelling, the shape and size can look very different. Swelling does not mean that it's going to swell in the shape that we planned, or it's not supposed to swell in a nice shape. A lot of people think that if we have planned in this shape, it should be a bigger version of that. No, swelling will distort the shape. If this is what we plan, it'll be like that. Swelling in one particular corner will like change the shape of the whole eyelid. So a few common things that I can remember and mention right now is like the inner corner usually looks very tight because the center portion is swollen. So it stretches like that, and the inner corner can get very tight. You can see a tight band. There can be slight amount of swelling because of inflammation where the stitch is present on the skin. So you can see bumps here and there sometimes. The eyelashes can be everted because of this swelling and usually comes down as things get better with time. And what else? The bruise can be on one side only, and no bruising on the other side. So that's what kind of you know makes it concerning for a lot of people. I've noticed that if even if there's a lot of bruising, if it stays the same on the two sides, or if there's a lot of swelling also, if it stays the same, people are usually happier because it looks normal, and other people around them also think like, okay, at least it's same. Everything seems to be done well. It's just bigger because of the swelling. But then it's only when the two sides look so different, or if bruising is only on one side, that one side looks small, one side looks big, and um, people get concerned as to why it's so different, if things went wrong or something like that. So in order to really know whether it's a swelling or something really went wrong, we have to wait till the final result, until unless it's very concerning that it's like they can't live with it or something. Because let's say this is the amount of swelling and this is the amount of swelling in one side. As time goes by and we come to like 3 months or 4 months or 6 months, when we see the final stable result, it can get similar. It just might be that the swelling was less on one side, or that one side was recovering faster, but ultimately the two sides will mm, come to look similar. So that's what we see in most people. So if it's just 2 or 3 days after a procedure, or even if it's like 10 days, 20 days, or 30 days, it's too early to decide that it's different or something like that. I mean, uh, we should not judge it ourselves. It's always better to go back to your doctor and show and ask for their opinion as to whether they think it's normal, or if there's a high chance of it getting to a similar size with time, or if they think like it looks different. Because I can tell when I see people at 15 days, 20 days, 30 days, because of the high number of experience, I can usually tell whether it will look, it may look similar or equal with time as healing occurs, or if it's because of a slight difference in the level of stitching and all that. So, yeah, if there's anything else you would like to know about cosmetic surgeries, especially Asian blepharoplasty and all, let me know in the comments and I'll be happy to share more with you. Thank you for watching. See you. Bye.